Hello, you're welcome to the Dr. FAKAY show.
This episode is on health matters and we'll be discussing stroke. Here with us is Dr. Paul Volaji, who is going to enlighten us on this globally common ailment called stroke.
Dr. Paul Volaji, so nice to see you today, and you're welcome on our show. I want to ask you to tell us a bit about yourself, more especially your practice back in Nigeria, and what do you do presently in the UK?
Okay, thank you so much, Dr. FAKAY. It's such a privilege, to be interviewed by a great maestro as you. So, I'm actually currently a specialist registrar in rehabilitation and stroke medicine in the United Kingdom. And before I came to the UK, I was a senior registrar in neurology. But since I've moved into the UK 2019, I've just narrowed down into stroke medicine and rehabilitation. And apart from that, also I'm also a member of the African Stroke Organization and a member of the British Society of Rehabilitation Medicine. And also, I had the privilege of publishing a landmark research article on COVID-19 and cerebral venous thrombosis, which is a form of stroke. And your Indian government actually used that, for them to make like a guideline.
Thank you very much. Dr. Paul, we're going to be focusing on your area of specialty today, and that is stroke. Like that on the Dr. FAKAY show we have like 3 or 4 categories, and one of them is on health matters. So on health matters today we're going to be discussing stroke. So I want you to enlighten us and our viewers on what is stroke and what do we need to know about stroke.
Thank you so much, Dr. FAKAY. I think this is a very important topic in the world at the moment. And stroke, as we know, from the word strike, just like it's usually, something suddenly somebody either loses his ability to speak or might not be able to move a part of his body, or sometimes even might just have like a deviation in a part of the face. This suddenly happens either because there's a clot blocking one of the vessels that supplies the brain, or there's a bleed in the brain.
Okay. What are the things that we need to look out for, or what are the things that are shown when somebody has stroke?
Thank you so much, Dr. FAKAY, for that question. From the word, there's an acronym called FAST, which is actually what is used to educate people about symptoms of stroke. FAST means, F stands for, if you notice any problem with your face, you look at the mirror and notice that one part of my face is not the same as the other, then you need to be very careful. You might have a stroke. A in the FAST is arm, which means if you've got any weakness in your arm, usually in one side, you might have a symptom of stroke. And S stands for speech. So if suddenly you just notice that you can't speak again, that might be a stroke. And the T stands for time, which means it occurs suddenly and you need to make sure you see the doctor immediately.
Okay. They say concerning many medical ailments that there are always risk factors attached to different medical presentations. So when it comes to stroke, what are the risk factors that we need to know that is attached to stroke?
I think that's a great question once again, also because before we can actually prevent stroke, we need to know what will predispose anybody to have a stroke. The most common risk factor is actually age. The older you are, the more risk you have having stroke. But we can't, nothing we can do about age. I can't reverse my age. I can't grow younger. Also, so there are some other things, risk factors, which we can actually work on and prevent. And other risk factors are blood pressure problems, like people having uncontrolled blood pressure problems. But if you have blood pressure problems and it is well controlled, the risk factor reduces. Apart from blood pressure problem is diabetes, problems with the sugar, especially when it's not controlled. Some people might not know they have diabetes, and sometimes it might even be stroke that might make them to know that they got problems with the blood sugar. So it's very important for somebody to check, especially above 40s, to check your blood sugar to be sure that you are not diabetic. Another risk factor in which we call something habitual, like smoking. The more you smoke cigarettes, the more it clogs those blood vessels that supplies your brain, and the more you're at risk of having clots in the brain. Alcohol too is known to be a risk factor for stroke. So the more alcohol, especially for males, if you're drinking more than 21 units of alcohol in a week, or for females more than 14 units, that might increase the risk of you having a stroke. Apart from that, also sedentary lifestyle. In the times when we're forming big men, almost everywhere you go you're just in a car, you're not walking, you're not doing exercise. Those are also some risk factors that I can say. Although there are also some other risk factors which a lot of times we might not be able to control, like genetic, something like related to a father or something passed from a family. But those ones we don't really have a control over. But the ones I've just mentioned before that is what I think we have a good control over.
Okay. I was, as in, I heard in the past that some people that are big are more predisposed than those that are not big. Is that true? Like
Yeah.
obesity?
Yes, I do. Yeah, I do agree. I mean, there's a risk factor. If the more you are obese, the more you are at risk for any problems with the heart or with the brain. But like I
Okay.
said, it's not just being big alone. It is also a combination of many factors in place. I've seen people that are very slim and they're having stroke, and I've seen people that are fat and they don't, and they never had stroke before. So it's not just being big alone. It's more of actually the level of your cholesterol in your blood, which is a
Okay.
major thing.
Okay.
And it's known that sometimes the bigger you are, the higher the level of your cholesterol. So it's more of a cholesterol that actually predisposes one to stroke.
Okay. Then when it comes to issue of getting a partner or marrying or whatever, they usually tell people to check genotype. Is there any link of any type of genotype to stroke occurrence, or it just general?
I mean, that's another great question from you, Dr. Fakay. Yeah, well, definitely there's a link between people with sickle cell disease, and stroke itself. You know, one of the causes of what we call a stroke in the young. But it's people that have like the sickle cell disease itself. But people who have the sickle cell traits like AS or something like AC, I do not think they are predisposed to stroke. I don't have any evidence to support that increases the risk. But if you have SS or SC, if you have a confirmed sickle cell disease, then that increases the risk of you having stroke.
Okay. So now, after somebody has already come down with stroke, what are the management of stroke that you think will be of benefit to people at home? Because we know that such should be managed in the hospital by specialists, in the area. Can you just briefly tell us the management generally on stroke?
Like with the acronym I said, FAST. I think the most important thing is time. When you have a symptom of stroke, I mean, if you are in the United Kingdom or you dial 999 immediately, you call the emergency. If you are in the US, 911. If you are in Nigeria, you dial the nearest emergencies, you go there immediately. Because it's been said that for every minute you lose 1.9 million neurons, which is your brain cells are dying. So the most important thing is that when you have these symptoms of stroke, face your arm weakness in any your arm or your legs, or you have speech problem, you have to call the emergency ambulance immediately. So time is of essence. So once you call the emergency ambulance and they take you to the hospital, they do scans to confirm what sort of stroke you have. Either it's a clot in the brain or it's a bleed. If it's a clot in the brain, the most important thing they need to do is to break the clot. Once we are able to break that clot from the brain, it will open up the pipe, the blood vessels that supplies the brain, and would help in reducing the effects of a stroke on your brain. So time is of essence. Also, because if you get to the hospital late, especially more than 4.5 hours, they might not be able to use special medication to break down those clots in the brain. Another thing also they can do, apart from medication, is what we call thrombectomy, which means there's a special device in which they put through your blood vessel to remove the clot. But that intervention also is also time related. If you get there more than 6 hours, sometimes you might not even benefit from the intervention. Then once those interventions has been done, once the clot has been removed, then you are admitted into what we call a stroke unit, where you are observed. That is for clot in the brain. If it's for bleed, it's another processes. Because currently there's really nothing actively that can be done to remove, most of the time, to remove the blood from the brain, except if clearly the blood is compressing your brain, then they might need to go to your skull and open it. But if you have a bleed in the deep part of the brain, usually what they just do is to just admit you into the stroke unit, observe you, control your blood pressure, and make sure that you don't have any bleeding problem. That is all. But for the clots, as I explained, those are the things they do for the clots.
Okay, thank you, Dr. Paul. I want to find out. I want you to tell us about people around a potential stroke patient, people like colleagues at work, friends, family that are surrounding us? What are the things they should do? One, what are the things they should look out for? Two, what are the things they should do when it comes to the issue of stroke?
And I think, like I said, just know about the first symptoms. Any of your colleague, family member, suddenly you just notice that one part of their face has moved also to one side. They have one weakness in a part of the body, or either in the arm or in the legs. You notice that the speech, they can't talk well, or they even faint and lose consciousness. You must call the emergency number as soon as possible, because time is of essence, and that is the most important thing they need to do.
Okay. Then, when it comes to the global view and the effect of stroke, is there any public health interest when it comes to stroke?
Definitely, there's a whole lot of public interest. Number one is that, we are having an aging population. Life expectancy is increasing everywhere with a good healthcare system, and so in the next 5 to 10 years, majority of people will be more than 65, and so the older we are, the more there's a risk, of stroke. So that is a factor. Another thing is that blood pressure problems, diabetes, smoking and alcohol, those things are becoming much more, not just the developed countries, the developing countries, also because of our diet and so on, and also because of a lot of the technology, the fact that we now have, most of the times everybody's working at home. You've got your work at home, every single thing, from Monday to Fridays. You just need to be glued to your computer. A lot of people are not as active as they were before, and so there's a public health concern that the risk of stroke would continue to increase, and that is why it is a public health concern, because we are moving from infectious problem to what we call non-communicable disease, and they are increasing, so it's a public health concern.
So thank you, Dr. Paul. Is there anything else that you want to add to all the things you have enlightened us about stroke?
Yeah, I think something I also want to add is about that there's also what we call rehabilitation, which is very important when you have stroke. The fact that you've had a stroke and you can't move your hand, that is not the end of the world for you. There's something we call rehabilitation, which is in a way increasing or improving your recovery after stroke. And it's been shown that stroke rehabilitation actually improves lives after stroke. And so if you've had a stroke, there are some things that can be offered in rehabilitation that can help your speech problems, help your mobility, your walking, and that can help you with your activities of daily living. So that is a very key thing in stroke recovery.
Okay. Thank you very much. So, Dr. Paul, we are so happy that you honored our invitation, and we have really gained a lot from your wealth of knowledge in the field of stroke. And we look forward to seeing you again in the nearest future. We hope that if we call on you, you're going to answer us. Thank you so much, and we're grateful. Thank you. Have a lovely day, sir. Yes, sir.
Thank you so much, Dr. FAKAY.
If you have enjoyed this video and you're watching on the YouTube, please comment below, like this video, subscribe and press the notification button. Please remember to also share our video. Till next time, cheers. Part of this show is our merchandise. If you've learned and enjoyed one thing or the other from our videos on the Dr. FAKAY show, you can encourage our business by patronizing our merchandise. By doing this, you will help create more awareness about the Dr. FAKAY show, and more people will get to know and benefit as well from our videos. We have our logo printed on t-shirts, sweatshirts and hoodies. Get your copy.